Well, Trump's domestic policy agenda and the price tag attached to it hit the United States Senate today, which means it could likely see some changes even in that GOP-controlled chamber. After it cleared the House last week, Idaho Congressman Mike Simpson sat down with Joe Parris to talk about it. Simpson said this about Medicare, Medicaid, or Social Security, quote, "No one's going to lose those things," end quote. But that prompted many of you to say some other things, like, where's the fraud and waste Simpson mentioned? Or like this one, I'd love to believe what Congressman Simpson says. However, that is not what's coming from Republicans' mouths. I've heard differently. I guess those of us who are on Social Security and Medicare will have to wait and see how they play with our money. Then my understanding is illegals don't get Social Security or Medicare because, well, they don't have Social Security numbers. That one's from Mark. Meanwhile, this one, I would urge everyone to go to the Congressional Budget Office. We talked about this last week. Read the analysis of the bill for the truthful evaluation. So this week, Joe sat down to break down what Congressman Simpson said about the bill that passed the House by just one vote.
If you look at the text of the One Big Beautiful Bill, you will see the word Medicaid a lot. Medicaid, 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 Medicaid.
There's been a lot of things said that just aren't true. We're not taking away people's Medicare or Medicaid or Social Security. No one's going to lose those things.
But a clear statement from Idaho Congressman Mike Simpson on what the Big Beautiful Bill will or will not do to American social programs. A statement echoed over the weekend by GOP leaders like House Speaker Mike Johnson.
And you can underscore what I'm about to tell you. There are no Medicaid cuts in the Big Beautiful Bill. We're not cutting Medicaid.
This is an extreme contrast to Democrats who say the BBB will cost millions of people on Medicaid their care. Almost a carbon copy conversation at the Idaho legislature this year during conversations about controlling state spending on the program. Like Idaho's House Bill 345, which is now law, the bill seeks to change Medicaid's programming, and that includes a requirement for 80 hours of work a month for most able-bodied adults, more frequent program eligibility checks, and a loss of federal match percentage for states paying for undocumented and other classes of immigrants' health plans.
If you're here illegally, should you be getting Medicare or Medicaid? I don't think so. So yeah, some people like that will probably lose that benefit because we will get it back to what it's originally intended to do, and that's to help those people in need.
The context of this comment led some to say that undocumented people are not getting social program benefits because they don't have a Social Security number. However, there are 14 states that use state funds to provide Medicaid or Medicaid-like care for undocumented populations, varying to some degree between those states. The bill would penalize those states, dropping the federal Medicaid expansion funding from 90% to 80% in terms of federal match, putting a financial burden on those states, forcing them to make cuts. This is a financial cut that the GOP is seeking and also could result in millions of people losing care, to the Democrats' point. Idaho, by the way, is not one of the states in that conversation. Congressman Simpson and Speaker Johnson both highlighted that nobody eligible for Medicaid loses their coverage, which is true, but Democrats argue that the work requirement and eligibility paperwork could result in people losing care, a point talked about during the Idaho session.
It puts in extensive paperwork processing and submission requirements. The upshot of that is people get sideways with the reporting requirement and they end up stripped of their Medicaid coverage.
The problem Rubel sees from there?
If we kick 25,000 people off of Medicaid who are working but just didn't properly process all their paperwork, what's going to happen to those people?
It's the contrast of a strict program and fears that this proposal could lead to a program downfall. A death by a million cut, some advocates say, that isn't explicitly written in the text.
This could actually put us in a worse position with respect to this population than we were in before we passed Medicaid expansion.
If we don't get it, if we don't get it back to its original intention, that will be the biggest threat to these programs.
So let's go back to talking about coverage for undocumented people. Our neighbors just to the south, Utah, for example, they provide medical coverage for children regardless of immigration status. They also have a trigger law in Utah that says if federal funds drop, their Medicaid expansion ends. Idaho tried to do this but did not succeed this year. So if the Big Beautiful Bill passes, analysts like the KFF, they estimate that 78,000 or 23% of Medicaid enrollees could lose coverage in the state of Utah. So, Brian, this bill would also prohibit states from establishing new provider taxes or increasing existing tax rates, and it restricts how these provider taxes, aka the states, can be used in Medicaid. And long story short, that is a way that states like Idaho talk about like making their money back to help for that federal match. If the provider taxes are paused, and this is something that was talked about during the legislative session, it really hurts the income in the sense for how states pay for the Medicaid match.
Right, because I did take CK's advice and went to the Congressional Budget Office, and the thing is, like, yeah, it's going to lower the cost of the feds, but that's going to fall on the states when it comes to Medicaid, which would be, I guess, our rainy day fund that we have in there. And like the $267 billion less for SNAP, all those things are in there. And there's also that deficit that goes up to nearly $4 trillion over the next 10 years.
So it's an interesting session that's happening in the Senate right now. We'll see if the current version of the bill is what maybe makes it through.
Yeah, well, probably not. We'll see some changes, I'm sure. All right.